This next lecture is entitled The Role of Oxygen in Wound Healing, a very important building block from a basic knowledge standpoint. And Dr. Serena is going to share that knowledge with you. After Serena talks about the role of oxygen and basic mechanisms related to the use of oxygen in wound healing, giving you a broad overview of wound healing, I'm going to come back once again with the clinical correlation segment and spend some time walking through some cases illustrating the dramatic use of hyperbaric oxygen therapy in the management of our patients, particularly related to those patients that have hypoxic wounds and are at risk for limb loss. So enjoy Dr. Serena as he brings you to the world of oxygen in wound healing.
All right, for the next lecture, we're going to discuss wound healing and the role of oxygen in wound healing. Now, in most centers that we work in across the United States, you will find that the majority of hyperbaric patients will come out of the wound clinic. And so I think it's really essential that we understand wound healing, the role of oxygen in wound healing, and then in the end I'm going to sneak in a little bit of basic wound healing, just a quick overview, so that we don't forget to do those basic things that help us to get the wounds healed in addition to hyperbaric oxygen. So I'll talk about basic physiology and some biochemistry of wound healing, and then we'll just briefly contrast chronic and acute wounds. And then, as I said before, finally I'll just throw in a little bit overview of the 4 pillars of wound healing, which are really applicable to all wounds, both acute, chronic, surgical, you name it. Throughout this, I'm going to talk about the role of oxygen in wound healing, and that'll be the thread that goes through